Now let's go back down memory lane.
My apologies. Can we have you stand by? We just have a press conference live right now at Mass General Hospital. Can we have you stand by?
Sure.
Thank you very much.
Small metallic fragments that entered their body, pellets, shrapnel, nails that these bombs had, and some of them have additional injuries that we're addressing. Again, I'm happy to report at this point that the patients are sick but are in a rather stable condition, and thank God they're all alive. Most of the injuries were, again, lower extremity, major injuries. And from these injuries, they bled a lot. We controlled the bleeding rather rapidly, but certainly they lost a lot of blood, and that created physiologic problems. The younger patient so far was 28 years old, and the older patient was 71 years old. This bomb obviously was placed probably low on the ground, and therefore lower extremity injuries are to be expected. Most of the patients are conscious, but we do have patients who are medically sedated in order to alleviate the pain at this point, and therefore we don't have a full evaluation of their mental status yet.
Doctor, did you screen?
Okay, you were just listening in live to a press conference at Massachusetts General Hospital, and as a recap, a total of 176 casualties, 17 critical, and 3 fatalities. I'm going to bring back in Allan Bonner for one final thought on this moving forward. Allan, what would you like to see when it comes to officials giving out information to journalists? You were quite disappointed by what you heard in the earlier press conference.
Well, you know, actually, it's a good news story about journalism. You saw how those news conferences go. There are some boring and irrelevant questions, and journalists are asking, you know, questions on a fishing expedition. And when a good journalist goes back and writes this up or summarizes it as you just did, it's a tremendous service to the public. We all can't watch these never-ending news conferences. I would want the public to be asked to provide pictures, audio recordings, or any recollections of having been in that neighborhood for the previous week, because the perpetrator probably cased the area. I'm going back in memory, and I was before you cut away to the other news conference, to the gang of 17 suspects arrested in Toronto. When there were 6 to 9 police agencies at a news conference, my old friend General Ron Sheridan, who headed the Counterterrorism Task Force for Canada, laughed on the phone with me, and he said that proves no one was in charge. I counted 16 people at that news conference, which was more really a photo opportunity for the senator and the congressman and this, that, and the other person, and that you know, doesn't make a news conference go all that quickly. Same thing with SARS in Toronto. Reporters knew that officials behind a curtain were arguing with each other. You pointed out that there were disagreements in information given out, the number of injured. Not a big point, but it's worth making. And when they came out with their breathless news conferences that there were another couple of people who'd contracted SARS or who had died, they actually exacerbated the situation. They made everybody more nervous. So I would like the police to define vigilant. What are you supposed to do? Have you ever tried to call the police and report an erratic driver, drunk driver, strange noise in the neighborhood? You don't really get very far. You're normally, especially with the 911 operators.
And some interesting points there. Well, thank you very much for joining us, Allan. I appreciate your time.
Bye-bye.